If you look back 15 years ago, hip resurfacings were up to 20% of hip replacements that were done. And I do think that that's the right way to think of them as a different type of hip replacement. They failed at rates that were thought to be unacceptable, but if you look into the data, patients that were young, meaning in their 40s, patients that had larger implants, basically men, um, and had these implants placed correctly, they did absolutely fantastically. And that's what I have seen in my practice as well. The failures were in patients who had osteoporosis, that had very small implant sizes. And those implant sizes aren't made anymore. So the way to think about it is the socket side is the same, but instead of putting a stem in, you crown the top of the femur just like you crown the bottom of the femur in a knee replacement. The really only advantage that I see for patients getting a resurfacing is that the risk of dislocation, while it's a possibility, is a super outlier. They basically don't dislocate. So in my practice, the classic patient would be a 40-year-old fireman. He needs to be able to do anything he needs to do to fight a fire, including crawling around in weird positions, and not have to worry about it dislocating. And he's going to be the size and have good bone quality to support that implant. So it's a niche, a small number of patients, but it still is an operation. People still really do benefit from it.